Tim Shaw.
Thank you, Sabra, and thank you both so much for your address today. Can we get back to the health and well-being of our nation? You both know that in Australia, smoking is still the largest preventable cause of death and disease in Australia. The US Food and Drug Administration historically announced yesterday the authorisation and licensing of non-smoke generating nicotine delivery products. Your budget surplus will be delivered on the back of $17 billion in tobacco excise collected in Australia. If either of you are the Health Minister of Australia after the 18th of May, please tell this audience and the rest of Australia and rural Australia, whether addicted to the current tobacco product, when will you authorise the vaping product alternative to allow Australians to be able to make that decision to stop killing themselves? Greg.
Thanks very much, Tim. Look, with respect, I have seen the US EPA and they have referred to an epidemic amongst youth in the United States of vaping. What has occurred, I think, is a public health disaster, and that is not something that on my watch I am willing to countenance. We were asked a question before about powerful lobbies in Australia, and I think this is completely shared between Catherine and myself, to be absolutely fair. Both of us have stood in the face of the tobacco industry, which is backing. The tobacco industry is backing this vaping push. It's not something I support. When I spoke to MD Anderson, one of the leading cancer centres in the United States, they said they thought this was a public health disaster. And so it is far more a case of being a ramp on rather than a pathway off smoking. And what we're seeing in the US already, with millions of young Americans, as Scott Gottlieb, the head of the US EPA has said, is an epidemic out of all proportions as a result of these changes. So no, that's not what I'm proposing on my time, on my watch, so long as I'm in this role. More broadly, we have over $200 million that's being invested in anti-smoking efforts, $20 million that was added in the budget, but $180 million which is already there with a particular focus on Indigenous Australia, where we have smoking rates that are more than 3 times the national average. So that has to be our focus. We've seen Australia achieve wonderful things, and I know that Michael Wooldridge is in the room, and I acknowledge him and all of those health ministers that have been part of this on both sides. It's a shared national commitment and, I believe, a shared passion. But so long as I'm in the role, that won't be something that you're talking about, which we'll be adopting.
Thanks very much, Tim. You know, Australia has such a proud record when it comes to tobacco reform. The convention framework that we all agreed, which does mean, you know, you change the price, you remove all forms of advertising, has been really, really critical. And it is currently under attack, again, by the tobacco industry, who are walking the corridors of Parliament House yet again. Still, Liberal or the National Party still takes their money, which I just find extraordinary from a public health perspective. They are walking the corridors again and trying to use vaping as a pathway, again, to expanding their market. And we are going to resist that. It's not something Australia should countenance. We know that the science tells us, and the TGA here and the NHMRC, who have both looked at this, that this is not something that Australia wants to go down the pathway of. I commend the Minister for standing strong on this issue. I do note, however, that we've had the House of Representatives inquiry into this, but equally, currently I think you're investing in some research in this as well, into this space. I hope very strongly that that research and the way that it's conducted continues to ensure that Labor does not go, that the country does not go down this pathway. What is happening in the US at the moment for young people is a public health disaster. Australia can't afford to have that happen here in this country. We've invested $40 million in a new tobacco campaign. We haven't seen a good, strong advertising campaign to reduce the rates of smoking for the last 6 years. We want to see that happen again. We want to see investment in smoking cessation again. We do acknowledge that there are people in the community who find it really, really difficult to quit. This is a terrible addiction. We need to be able to support them well, but vaping's not the way to do it.